Namaste. My name is Dr. Zankhana Buch. I am serving as Chief Medical Officer at Apollo AyurVAID hospitals. Today I am here to share Ayurveda perspectives on a much known concern that the world is facing, the global burden of obesity. We see obesity, we understand obesity in different ways. For some, it is the broad muscle mass, weight, just the number weight as it is, 50 kgs, 100 kgs, 80 kgs. Obesity is translated very differently with different stakeholders. Weight, markers of obesity, weight, body mass index, basal metabolic rate, and the whole grading or classification of obesity with respect to BMI, which is proportionate to height and weight. Also, it is important to note that with this, there are certain clinical features that define obesity, like being heavy, chubby, or a flabby body with respect to certain organs of the body, like arms, abdomen, gluteal region, thighs, facial fat, etc. And these signs of obesity or flabbiness, difficulty in carrying out activities of daily living, to demark or to define obesity is very well defined in Ayurveda. It is not just a marker, it is not just one or two markers which can label you as obesity. One's own anthropometric measures, pramana, right? Samhanan, everything should be in correlation to each other. Along with that, there should be the markers of good health, which are told in Ayurveda. Good sleep, good appetite, motion, urination, energy levels, vitality, less co-infections. So this entire thing of health should be also qualified to let you know or to categorize you whether you fall into a category of obesity, overweight, or is this your constitution. So with this as a foundation, Ayurveda has told about certain traits of personalities where a person with Vata Prakriti, Vata dosha dominance Prakriti is almost always lean and thin. The frame is slightly smaller, tend to be tender, slender, like that. The person with Pitta dominance, Pitta dosha dominance Prakriti is medium, neither here nor there. It is in between. The weight is constant, no much fluctuation, etc. The third category, which is Kapha dosha dominant, is mostly likely to be large built, heavier compared to the other categories. So one needs to define which is your natural weight, which is your tendency, how are you born, how has been your growth, the prime stages of your life, puberty, pregnancy, post-pregnancy, menopause, perimenopause, menopause, how those have been, what are the changes of weight that your body has gone through, how quickly were you able to reverse, how quickly were you able to come to your baseline weight. So all these factors are important when one is dealing with weight management and especially obesity. Weight management includes both putting on weight as well as losing weight. So right now, as we are focusing on obesity or putting on weight, we need to understand from an Ayurveda perspective that it is Santarpanjanya Vyadhi. What does Santarpanjanya Vyadhi mean? Santarpan means nourish. Santarpanjanya Vyadhi means overly nourished. When nourishing aspects of body or food, absorption, malabsorption, etc., which goes beyond a point that is required, it leads to rasa dhatu dushti. The primary tissue which is in the formation of dhatus gets blocked, which leads to ama, that is inflammation. And this ama, then when the nourishing part of that rasa dhatu has to go to different tissues, it is ama laden, it is filled with ama. So then rakta is with ama, mamsa is with ama, medas is with ama. All subsequent tissues are filled with ama. So it does not get sufficient nutrition. So we can see this very beautiful example of percolation of ama from rasa to rakta to mamsa to meda. When we look as into obesity, we can see so clearly happening in conditions of prediabetes, PCOD or hypothyroid, where the disease pathway is being formed. Simultaneous manifestation, which you can see outside, is weight gain, obesity. So people say that I am putting on weight, but that is outside. There is an internal pathway of inflammation which is continuing to happen silently. One needs to pick that up. That is your obesity or being heavyweight related to just your features of eating not right or being sedentary, or is it really deeper? Are there any deeper inflammatory pathways being created and obesity is just the manifestation? I think this correlation is very important, because if you do that, then not just watching your weight or maintaining, but if you treat this pathway very clearly, you will see weight loss will be extremely fast there. You will get significant outcome because you have addressed the root cause. Similarly, like when we try to address these issues in different age groups, we need to keep in mind safety. We need to keep in mind all other aspects related to weight reduction. While there are aggressive treatments available in modern medicine for morbid obesity to deal with different kinds of surgical interventions, including bariatric surgery, it is important what are the after effects or sequel of that. While your endocrinologist or a physician has advised you to do so for bariatric surgery for some particular reason, you need to consider it very mindfully in a scientific way. But I believe that also you need to have a discussion with the treating doctor on the complications and consequences of bariatric surgery. And very open-minded discussion can be had, is there an alternative to this surgical intervention? I am very sure a very good endocrinologist, a physician would be, or a bariatric surgeon would want you to give a chance to get into healthy diet, lifestyle, modifying factors, modifiable factors that lead to good weight reduction. If you are able to do that, Ayurveda is certainly very comprehensive, very rooted system of medicine which can help you to understand the cause of obesity, the category of obesity that you are in, and which are the pathways that are leading to obesity. So, weight is not the sole criteria to look at for obesity. You need to look weight, change in your body mass index, how rapidly your BMI is changing, how rapidly the impact of all these changes is on your clinical pathways. How do your parameters look like? Your HbA1c, liver function test, ultrasound echoes of fatty liver, kidney function, cardiometabolic health, atherosclerosis, everything is very important when one is dealing with obesity. One should be extremely mindful to not rush to lose weight. Weight loss, weight management is a journey. One needs to be one needs to be very attentive of body responses, that how my body is changing with my age and stage of life. And with that, I am taking utmost precautions to choose my food, to chew my food, to be slow in my actions, to be physically more active, alert, agile, to take care of hydration, to sleep well. I think these are all, and also to keep in mind your genetic predisposition, your overall build, and how you are, that as a child, as a teen, as an adolescent, as an adult, as an elderly, this entire age group, the changes that you have gone through, you need to keep in mind. Once you do that, even when you are dealing with obesity, you will be mindful and you will be able to take a very scientific approach to address the burden of obesity. Thank you.